Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about diabetes and your brain. So, if you like the video related to my health, my way, I would like to request you all, please do subscribe the channel, hit the bell icon, give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Diabetes and your brain. Your brain is a finely tuned organ, but it's sensitive to the amount of sugar or glucose it receives as fuel, whether you have type 1 or type 2. Both the high blood glucose of uncontrolled diabetes and the low blood glucose that sometimes come with diabetes treatment can affect your brain. Now, the dangers of high blood glucose. Some of diabetes' effect on the brain are not obvious right away, especially when they are related to high blood sugar. With diabetes, you have an increased risk of damage to blood vessel over time, including damage to the small blood vessel in the brain. This damage affects the brain white matter. White matter is a part of the brain where nerves talk to one another. When the nerves in the brain are damaged, you can have changes in thinking called vascular cognitive impairment or vascular dementia. The longer you have diabetes, the more of a chance there is of developing dementia. But we see much less of it in people with type 1 whose diabetes is well controlled. People with type 2 may face a double whammy because they tend to have other problems that also can cause blood vessel damage. Diabetes can combine with these other problems to create inflammation that damage blood vessels, so good diabetes control is all the more important. Sometimes people want to try a lot of different things before they go to insulin or other injectable diabetes drug. The last thing they want is to take shots. But it's important to bring down your blood glucose early in diabetes and not chase it for 5 years. Now, low blood glucose can cause sudden trouble. If you tightly control your diabetes, it can be easier to accidentally slip into low blood sugar, and low blood sugar has more immediate obvious effects on your brain than high blood sugar. The symptoms of low blood sugar get worse. The lower your blood sugar goes, it can affect your mood and make it difficult for you to think. You might get a headache, feel lazy, have poor coordination, or have trouble walking or talking. Severely low blood sugar can give you seizures or convulsion, make you pass out, or put you in a coma. Repeated bouts of low blood sugar can become problematic. Going too low once in a while probably doesn't have a huge long-term effect on the brain, but if you have frequently low blood sugar, you can become unaware of it, and it's dangerous to live like that. This condition called hypoglycemia unawareness happens when your brain has trouble noticing low blood sugar level. When that happens, you won't get the usual early symptoms of low blood sugar such as nausea, hunger, shakiness, cold, or clammy skin, or a pounding heart. Usually these symptoms are enough to wake someone with diabetes up from people or from sleep. But if you have hypoglycemia unawareness, you might not wake up and your blood sugar can continue to drop until it's an emergency. Hypoglycemia unawareness can also catch you off guard while you are driving and lead to an accident or cause you to fall. The jury is still out on whether repeated bouts of low blood sugar can cause long-term memory problems or raise the risk of dementia. One large study called the Diabetes Control and Complications Trial showed that low blood sugar does not have a long-term impact on memory or the ability to think in people with type 1. But another study suggests a link between a history of severe low blood sugar and a higher risk of dementia in other older people who have type 2. The bottom line is that careful diabetes control is important. So, low blood glucose might not make you get dementia, but it feels terrible. High blood glucose may not feel terrible, but it might cause problems with dementia. Now, a possible Alzheimer's connection. Research does suggest an association between diabetes and Alzheimer's. People with type 2 diabetes are twice as likely to develop Alzheimer's as people without diabetes. But researchers are still trying to figure out whether diabetes actually causes Alzheimer. Alzheimer is characterized by local deposits of beta amyloid, and and protein accumulating in the brain. So in some people with Alzheimer, beta amyloid form clumps that interfere with nerve cells' ability to communicate with each other. In the pancreas, where insulin is made, there are similar proteins that lead to damage and the death of the cell. It's likely to be a shared risk for developing either Alzheimer or type 2, but because they think that cause goes wrong in both of them is very similar. That's all about the diabetes in this video. I hope you all liked it. I'll definitely come in the next video with my another content. Till then, God bless you. Bye bye and take care.